All right, thank you so much for sticking with us for the second half hour of Friends at 5 today. I'm Andrea Mock, and we are talking about younger kids now able to get their vaccine. Darcy?
And I'm Darcy Strickland. Children as young as 5 years old are now eligible to get the Pfizer COVID-19 vaccine. The announcement came down yesterday from the CDC. It's the news lots of parents have been waiting on. According to Pfizer, the vaccine is 91% effective for children. News 19's Tai Wong is joining us now from Prisma with more on what parents need to know. Tai.
With children getting vaccinated now or able to get vaccinated starting tomorrow, I spoke with some parents who say that they are actually against getting their child vaccinated. Now, they tell me it's because they want to see more evidence on the effects that it has on kids and what tests were done. But one parent I spoke with today says she's actually excited to finally have her son vaccinated and won't be as worried when he goes to school.
My husband and I, our family, have been vaccinated. We're all in the process now of being vaccinated with the boosters. And so we've just been waiting on the final word from the FDA and CDC for 5-year-olds to be able to be vaccinated. So we're looking to get our son scheduled as soon as possible to get his first dose.
She says she hopes other parents also get their children vaccinated to prevent the spread of COVID in schools. Now, coming up on News 19 at 6, we'll hear from Prisma health officials on what side effects the children who get vaccinated might see. But for now, reporting at Prisma Health, Tai Wong, News 19 WLTX.
All right, Tai, thank you so much. It is definitely exciting news many parents were waiting for this final approval for the COVID vaccine to go to our younger children from the CDC. Now, as part of CBS This Morning, the director of the federal agency talked about what makes this dose so different from the dose you and I got.
Young people are not just small older people, and we need to, with all vaccines, we have different doses. With all medications, we actually have different doses. And so what they've done in these clinical trials is to look at dose de-escalation to make sure that the younger children are getting the right dose, both to balance the effectiveness and make sure that it's actually working well, and to make sure there were no side effects. And they absolutely hit that sweet spot at this dose.
Well, Dr. Walensky also shared with regulators on the advisory committee, reviewed a lot of data before making this recommendation. They did not take this recommendation lightly. They, of course, reviewed months and months of data on that smaller dose. And we know you have questions too. We wanted to speak to one of our own local experts. So joining us live in the studio tonight is Dr. Lauren Matthews, a pediatrician with Lexington Medical Center. And Dr. Matthews, you and I just had a chance to chat, and you were saying personally, as a doctor, from what you've seen, you are very excited about kids ages 5 to 11 now being able to get this vaccine.
Absolutely. This is such a huge milestone in our fight against COVID. Now we can help protect our children's health, but also we can help them get back to their activities that are so important to their emotional and mental development.
Dr. Matthews, what do you say to a parent who is on the fence about whether or not this is the right decision for their child?
Sure. Well, with any vaccine, there are definitely risks associated, but in this situation, the benefits far outweigh any potential risks. Additionally, the CDC and the FDA have gone through extensive data in all of the trials, and this vaccine was very well tolerated in the 5 to 11-year-old age group.
All right, you and I were talking, and you said basically this virus really exploded for our kids around the beginning of the school year. Talk about that and about what you saw and why this Delta variant really did affect the younger patients much more than the first variant.
Yeah, in our children, we saw a disproportionate number of new cases in this 5 to 11-year-old age group. In fact, COVID was the 8th leading cause of death in the 5 to 11-year-old age group. Over the past summer, we saw an extensive number of new COVID-19 cases requiring hospitalization, which was unlike anything else we had seen throughout the pandemic.
Yeah, certainly don't want to think about any of our kids being hospitalized, but we also got questions for you from Lexington County. We talked with some viewers there to see what they wanted to know. Let's listen in on this sound.
Would you recommend the vaccine for your kids?
Yes, I absolutely would recommend this vaccine for my children.
All right, and another viewer wants to know, how do you know if the vaccine is safe for your child? Did you test it on 5-year-olds to see, you think that the vaccine was tested on 5-year-olds to make sure that it was safe between kids 5 and 11?
This vaccine was absolutely tested on 5-year-olds. It was tested on every age group in the 5 to 11-year-old range. We have to trust the science and the data behind it that's saying that it's safe.
Another question for you. We've heard over and over from healthcare professionals that children are not just little adults. Can we talk about some of the side effects that will impact our children differently, or maybe even if they're the same as the side effects as adults had when they were first vaccinated?
Well, for our children, this dose in particular is going to be 1/3 of the size of the dose that the adults and older teenagers received. So because it's a smaller dose, we're thinking that the side effects should be less common and more mild if they are present. And those side effects would include the traditional or typical side effects that you would see with a vaccine. So redness around the site, tenderness, maybe some body aches, fatigue, but overall should be well tolerated, and those symptoms should resolve within a couple of days.
All right, I just want to ask you a question because I know that this is something that all the kids watching, now that kids are in school, if they get a vaccine on a Tuesday or a Wednesday, do you recommend that they go to the school the next day? Should parents keep them home to watch for side effects, or just play it by ear?
I think they should probably just play it by ear, but if they're feeling well enough, school is the place that they should be.
Okay, so that's it, kids. You don't get an excuse to miss a day of school. Thank you, Dr. Matthews. She's going to join us again in about 10 minutes to answer more of your questions. Of course, if you have a question you want her to answer, you can always text us at 776-9508.
And remember, we're the place to get all the updated information about COVID vaccines and your children. Go to our website, WLTX.com, or you can visit our mobile app. And you can also, again, send in your questions, 803-776-9508. Dr. Matthews is here through the rest of the newscast to answer those questions for you.
All right, let's get to some other news of the day now. South Carolina has received more than $10 billion in federal aid to help recover from the pandemic. So where has that money gone, and how is it helping you and your community? News 19's Julia Kaufman finds some answers.
When the pandemic forced people to lose jobs and kids to stay home from school, federal funding aimed to help communities get through tough times. First, South Carolina got $1.9 billion from the CARES Act. Governor McMaster created Accelerate SC to help decide how the funds should be spent. James Burns is their chair.
With the CARES Act funding, where we identified issues were things like broadband, right? Schools were going remote largely at that time, and trying to understand the access to broadband was something that this group did.
Burns says CARES Act funding largely went to broadband mapping and expansion projects, hotspots for kids, stockpiling PPE, COVID testing, and
probably the largest amount was $500 million to that we recommended for the Unemployment Insurance Trust Fund.
Projects funded by the CARES Act, like broadband expansion, were required to be up and running by the end of 2020. Now, almost a year after that deadline, South Carolina is still deep in the pandemic, and more aid has come from the American Rescue Plan to the tune of $9 billion.
It's COVID-related, it's infrastructure-related, it's revenue loss related. So there are a bunch of different things it could be used for.
The majority, according to Burns, is going directly to municipalities, K-12, higher education, and public health. $2.5 billion from the American Rescue Plan still needs to be allocated. Chairman of the Ways and Means Committee, Rep. Merle Smith, says the General Assembly will take that up in January.
So we need to make sure that our state is prepared financially to handle COVID and to bring us out of this pandemic. And that needs to be our first priority.
The latest funds have a spending deadline of 2026, so Accelerate SC and the governor see it as an opportunity for long-term investments. But Smith says hospitals and COVID response will likely be at the top of the list.
Let's make sure that we address the needs for COVID first, and then we can make these monumental investments into this state.
Smith says those monumental investments may include more broadband expansion, water and sewage upgrades in rural areas, and improving highways. In Columbia, Julia Kaufman, News 19, WLTX.
All right, thank you, Julia. Coming up next, we've got a local doctor in the studio answering your questions from Lexington Medical Center tonight about younger children now being able to get the vaccine. That's next. All right, for the first time, children 5 to 11 will be able to get a kid size, as they're calling it, version of Pfizer's COVID-19 vaccine. The announcement by the CDC director, Rochelle Walensky, came only hours after an advisory panel unanimously decided Pfizer shots should be opened up to the 28 million kids. Wrap your mind around that. 28 million kids in America in that age group. So today we spoke with Dr. Jane Kelly on why this vaccine is so important for kids.
The risk is too high and too devastating to our children, and far higher than for many other diseases for which we do routinely vaccinate children. And I think that's a very important point to understand. The illness and death that a child could experience from COVID-19 is statistically higher or more severe than it is for other diseases for which we already routinely vaccinate our children.
Well, millions of shots made by Pfizer and its partner BioNTech have already been shipped to states, doctors' offices, and pharmacies right here in South Carolina. So conceivably, you could get your young child, age 5 to 11, vaccinated as soon as you like. Call your doctor's office. And speaking of calling your doctor's office, we are so excited to have Dr. Lauren Matthews, a pediatrician with Lexington Medical Center, back with us today. And I'm sure you will start giving these shots out very soon. Why is this something parents of children ages 5 to 11 should do?
This is absolutely such an important vaccine for our children ages 5 to 11 to receive. We know that vaccines are the best way to help prevent illness, but also hospitalization and potential complications that may arise from contracting COVID.
Dr. Matthews, would getting this vaccine interact negatively with any other child immunizations that are required?
No, in fact, we're in the beginning of vaccinating for the influenza virus, and so you can receive the flu vaccine and the COVID-19 vaccine at the same time. It would just be in different sites.
For many people who are still worried about side effects, that's something I've heard from friends with kids in the age group. They're worried that there'll be some negative side effects. What do you say to ease parents' concerns about giving this vaccine to a child as young as 6 years old?
This vaccine has been well studied, obviously in the 5 to 11-year-old age group, but also in the millions of vaccines that we've already given to adults across the country. And so we really have to trust the scientists that are looking at this vaccine and its safety.
Dr. Matthews, is there a child ages 5 to 11 who should not receive this vaccine?
There are some children that will have contraindications to this vaccine. The number one is a child that has a previous anaphylactic reaction or allergic reaction to any components of this vaccine.
All right, Dr. Matthews, thank you so much for your time tonight and your knowledge. And when do you at Lexington Medical Center expect to start giving these vaccinations out to younger children?
We will begin vaccinating children in the 5 to 11-year-old age group at our community site tomorrow, which is Brooklyn Baptist Church.
Wow, that is exciting. Well, there you go. Tomorrow at Brooklyn Baptist Church, you can take your children ages 5 to 11. Thank you so much, Dr. Matthews, for your time tonight. We appreciate it.
A number of pharmacies are planning to start kids' COVID-19 vaccinations at several locations starting this weekend. CVS, Walgreens, and Rite Aid are among the major chains that plan to start vaccinations for kids as young as 5 in the coming days. Pediatricians' offices and hospitals also began inoculating kids on today, with schools and other locations planning to follow suit in the days ahead. We have details on how you can schedule vaccine appointments at local pharmacies for your child on our website. Just go to WLTX.com. Stay with us. There's more Friends at 5 coming up after this break.